I like that.
You going plenty for your niece.
I got to go over tonight.
I hate to take it away.
You got to what?
If these people be popular for your pay.
Alright. So, we're going to talk about what a delivery system is, the components of a delivery system, and then several types of healthcare facilities.
Healthcare delivery systems.
Alright. So, healthcare industry is made up of any delivery system. So, a delivery system is a facility or organization that provides healthcare services. So, write that definition down what a delivery system is.
Yeah,
I can write it on my bed ring.
Sure.
I know that ring. No,
she never speak up.
man, you got out of this thing.
That nigga staying straight. I already got my 50. Fuck all that other shit. I'm not nice. You look like a charge.
What they clean my car?
Wait.
My bad, I got 2 times huge.
Breakfast. We been breaking into temptation. Miss Henry. Me and Jacqueline, they were breaking you to temptation.
They the temptation.
Me and Jacqueline, they were breaking you to temptation. I'm ready, baby. This song be stuck in my head. Ooh. You don't know that about it. Jacqueline.
I had to leave it out.
One thing about the little console paper.
This is Houston's announcement. Teachers bus 101 has just arrived. Please
Man,
allow
that's
me
they
to
kind of
introduce
shit out
the
there
class.
back.
Thank you.
So, you can get the parcel out, but you have to sign up. Like, use that website, sign up first. The district code gonna be on the, like, when you log in. You'll get that to, you need a district code to log into the app. Alright, so, you have many different types of delivery systems. You have hospitals, long-term care facilities, medical offices, labs. These are all examples of healthcare delivery systems. We talked about that the other day with the government question. Delivery systems can be owned by private companies, belong to a government agency, or function as a nonprofit organization.
Oh, the summer gone. At 320. At 320.
Components of health.
Alright, so although you have different delivery systems, they have basic things that are the same. So you have services. All delivery systems provide one or more healthcare services to a specific group of people. You have consumers, any person who needs healthcare services. So if you're going to some place, you're going to one of these delivery systems, then you're gonna be a consumer. Healthcare personnel, those are the people that work at the healthcare delivery system, and then payment for services. Methods of payment for delivery system services.
Let me read the next slide. You heard me?
What?
Let me read the next slide.
Let you what?
Read the next slide. Because you know I'm gonna read to a therapist in the medical field.
Alright.
Oh, what's up? Stop playing with me. Stop playing.
Read it.
So good, so long, strong.
I'm reading it.
Oh, you want to get up or not?
Just whatever you like.
Question 1, and y'all better be listening. What are the four basic components of our healthcare delivery system? The first. Oh, that's in the last.
I got first, I got last. Right. Services, consumers, personnel, and payment.
Hospitals.
Shoot, don't go so quick. Who's gonna read that? Read it, James. You read that A hospital.
Alright.
That's worth the
A hospital is a healthcare facility that provides health services. Hospitals vary in size, ownership, and the type of services they provide.
Mm-hmm. Size. Some hospitals are small and provide basic needs for community. Other hospitals are large and offer a wide range of services that include treatment, education, and research.
Ownership. Many hospitals are classified as, how you say that?
Classified as
Proprietary.
Oh, that's too big. Which means they earn a profit from their services. The P hospitals are usually privately owned agencies. Hospitals that provide their services for no profit are called non-profit or voluntary. Other forms of hospital ownership include government hospitals and religious hospitals.
You forgot that word. You said P hospital. It's a word.
Proprietary.
Proprietary.
Services. General hospitals treat a variety of conditions. Resident hospitals provide service for particular conditions or age groups. For example, pediatric hospitals treat children like you. And what that word is? What that other word?
Oncology.
Oncology hospitals treat individuals with cancer.
Yeah, so oncology has to deal with people that have cancer. Like a person, a doctor that. What is wrong?
You better play with your grandma.
Man, Jaquaria reading that he comes from pediatric hospitals, and he gonna tell me something like you talk to her right there. So he read some oncology hospitals, and she gonna tell Jaquaria like you right there.
And I said like a woman.
They up here arguing about what hospital each other go to. Well, all right, let's go to the pediatric.
Yeah, y'all do. I don't.
I mean, of course, we do.
I'm 45.
Oh, God. All right. Hospitals vary in size, ownership, and types of services.
True. Why you pushing bird?
Proprietary.
Right.
Long-term care facility.
Alright, so long-term care facilities are another type of healthcare delivery system. They mostly provide care for elderly patients. However, some long-term care facilities offer treatments for patients with disabilities or those in rehabilitation. Different long-term care facilities provide different levels of care. For example, nursing homes care for patients who can no longer care for themselves, whereas independent living facilities allow patients to rent an apartment and use only the services they need. These services may include transportation, housekeeping, and laundry. Do y'all have good nursing homes too?
No.
You said what?
I said, do y'all have good nursing homes too?
I don't know, but I need to be trying to buy my mom one. In the morning, y'all mom go to the nursing home. My mom needs some friends.
I swear to God.
Who you gonna put your mom in a
She
nursing home?
fuss too much.
She gonna be in there
You
making
don't
up
mean she need to go to a nursing home.
She be having too much going on.
but my mom gonna be in there making up like you.
Hey, and rolling
What you say?
They're gonna be making up like you.
rolling Ooh, I keep forgetting. Oh,
Okay, I got to record. They're making us do it.
they be watching them.
Oh, yeah, some people your player be watching them because they'll send me a
No,
message
I'm
all
talking
post.
about the people.
Oh, I don't know. They have access to get into our stuff, so they might. I told y'all.
Medical offices.
Alright, so you have a medical office. It's a type of delivery system. Examples include family doctor, eye doctor, and the dentist. Some medical offices are operated by just one or two doctors. Others are made up of large groups of physicians and healthcare professionals. Like hospitals, some medical offices treat a wide range of conditions. A family doctor, for example, will examine a variety of patients. However, many medical offices are specialized and offer treatment for specific conditions or age groups. Ophthalmologists examine only eyes, and cardiologists deal only with disease of the heart. So,
Oh, I gotta go to the ophthalmologist next week. I wear glasses.
you do?
You'll never catch them on my face.
Do you wear contacts? I wear glasses, but I wear contacts. Cause I don't like
when
nothing
you
on my
got
face.
one, but I keep me smile because
Y'all take care of your eyes. Alright.
So carrots good.
All long-term care facilities provide the same level of care.
False.
Family doctors examine a wide range of patients and conditions.
False.
Because family doctors can deal with the baby.
Oh, talking about a doctor, a family doctor.
No.
No, a family doctor can
Like a family doctor, they do everybody.
Mama, the dad.
The whole family.
Oh.
And then, you know how it's like a general practice doctor, they can deal with like everything.
Yeah.
Cause some people, they go to like just one doctor for everybody.
Behavioral health services.
Y'all, I got the baby yesterday, and I put his legs up to his stomach and just pushed it real hard. Good. I seen on TikTok.
Why you had to make it sound like that?
I'm just saying that I can
Sound like you breaking the baby.
I just sneeze, you had Jackson, then I put it in.
Did he need it to pass gas or something? Oh.
I just did it because I
Oh
seen
my
on
God.
TikTok. I just thought of it. I did it.
Oh, hold on. I think y'all got something right now.
You just said that.
Medical offices. Long-term care facilities.
When teacher appreciation?
In May.
I'm bringing it
It's usually the same week as nursing week. It's the same week.
Oh, you want the apple with a worm?
No. No.
What you want? You want the lamb truck? A lamb? Hey,
Which one y'all supposed to be right now? Let me see.
this my baby.
Tomorrow.
Alright, so y'all need to know for nursing home and independent living facilities. But nursing home and independent living facilities, they both care for elderly, disabled, or rehab patients. So long term and nursing homes, they both care for elderly patients, disabled patients.
I know y'all did post my Facebook say y'all be going to prison fitness for a whole year still like a police.
Shake like that too with the waist trainer on. Slow, like slow it up. If you want the waist trainer on,
Nursing homes
yeah.
and independent living facilities.
No, you just stop saying that.
Both care for elderly, disabled,
Independent. That was that. Independent.
living facilities. So nursing homes and independent living facilities, both ELD.
Now you said please. Don't say you don't. Please don't.
Or LY.
I just asked you that. You said what I said.
So you got elderly, disabled, or rehab patients. Y'all got it now? Oh, you don't wrote something down?
Yes, ma'am. I feel like you let us pay way too much. I feel like you let us pay too much.
Like,
Medical offices. A medical
We need to start
behavioral health services.
raising our hands.
kindergarten. Y'all wanna feel like y'all in
No, I'm saying like raising your hand when you talk. This kindergarten.
Mama, do we got a job or something?
Alright, so behavioral health facilities make up a significant part of the healthcare system. Behavioral health involves the connection between behavioral health and well-being. Some behavioral health issues are the result of individual choices. Others, however, can be outside the patient's control. Medical studies show that a healthy mind is just as important as a healthy body. Some behavioral health facilities treat patients suffering from behavior or mental health disorders. Others provide counseling to people struggling with substance abuse and addiction. Another important role of behavioral health facilities is to provide aid to victims of abuse and domestic violence. Part of that aid might involve directing patients to an organization or resource such as these for additional help. Behavioral health services commonly encounter patients needing treatment in these areas.
I need treatment in them areas.
What areas you need treatment in?
Anxiety.
So you have
depression.
anxiety.
Depression.
The American Psychological
So you got
Association
something-
describes anxiety in regard to both emotional and physical symptoms that include tension, worry, recurrent intrusive concerns, as well as higher blood pressure, sweating, dizziness, and accelerated heartbeat. Depression, the American Psychiatric Association refers to depression as a serious medical illness affecting both feelings and actions. Left untreated, it can affect a person's ability to function in both their professional and personal life. Symptoms of depression are widespread, but commonly have a negative impact on mood, interest, appetite, and sleep. Substance abuse, use of alcohol, drugs, or other substances that affect health, work, school, or home life is considered substance abuse. Suicide or purposely ending one's life is a risk associated with failing to treat the behavioral health issues mentioned above, along with many others. Behavioral health services and facilities do their best to assist patients with issues that might eventually put them at risk of suicide. So it's okay to, if you need help with behavioral, like mental health and stuff like that. Sometimes people need to see somebody or talk to somebody or get medicine. I am all for people, if you need medicine, you take the medicine.
Can you prescribe me some?
No, I don't write them.
I got depression.
I need
I have
some for
anxiety.
anxiety. And
I have anxiety and I
post-depression.
take something for it.
I need some. I be having panic attacks.
Panic attacks make you feel like you're dying.
I mean, anxiety attacks.
And that's like the month that is in it.
Yeah, anxiety.
I need to live with it.
I need help
I
with
gotta go through
post-depression.
somebody. I do not talk to them about what's going on.
I can't find no counselor. Like, I need a counselor for real. I got a lot of stuff to talk about.
We just got one upstairs.
I don't know nobody here.
I was opening up to them. I went to them.
Why not? Did you go to him long enough?
It was legit.
Well, you might just, I mean, some people just got to find the right person to talk
It's
to.
hard for me to open it to somebody. Like, for real. When I was depressed and stuff, my mama didn't find out till like 2 or 3 years later. And like, my sister knew, but she never confronted me about it. She said that her boyfriend had told her that he looked like something wrong with me. And stuff. But she said she didn't take it serious until I actually told them what was going on. I don't think my mama
No, that's a
would know. She tried it. She just, when I told her that I was getting my sister, she told me something. Anybody that feel like they got killed is a weak man. Girl, I ain't mean. Like,
I just said, oh God, I took the group chat my cousin somebody, and they wouldn't believe me. That's it.
y'all, like, I used to be happy I know it. Yes,
So,
they know.
it was a change.
Oh,
So, nigga.
and they don't even be nothing that make your mood change. Just change out of nowhere.
Did you go to somebody? No.
No, I kept that doing
I was
years myself. Like, my only escape from depression was going to school. Mine was going to school. Like, every time I went to school, it helped get my mind out of depression. But as soon as I got back, I was back to square one.
I mean,
Betty, when I jumped in the cab, you said,
you probably needed to talk to somebody. It can help, but they can also prescribe something, I'm out here with some money.
I ain't depressed no more, but
Give me a check, that'd be alright.
I ain't depressed no more, but sometimes he like wear post-depression.
But I mean, you might like it's not necessarily that you're in a state of depression, but it's still there because it might be something that you find that triggers whatever you know.
Yeah, like post-depression.
But see, like I had an anxiety attack, which I didn't really ever think that I had anxiety or anything like that. But I had an anxiety attack like my first year working here. So I ended up because it felt like I was having a heart attack. Like I woke up like it was like 4 o'clock in the morning, and it just didn't feel right. So I went and they gave me something, and it helped. I've been on it for like a couple years now. But, they always ask me, you want to go up on a dose? And I feel like the dose work is fine. I ain't trying to take a whole bunch of medicine.
I need some for advice.
I take Zoloft.
Especially social anxiety. I got that real bad.
You do? I can't tell.
That's why I be walking past y'all and I speak sometimes.
Well, if you got somebody that you know, then you cool. But if you just by yourself, you not gonna come in.
No, when I'm walking in front of a large crowd, like
I would
if
just
I'm
shut
around
down.
somebody, I would tell everybody to just walk around me, just come me, cause I be feeling like everybody looking at me the whole time, don't nobody understand me. That's just how I be feeling. Like I don't like walk, especially in basketball games. I cannot walk out by myself. Like everybody got to surround me. That's why I started going to parties because like I'm standing in front of the whole time. Like I'm real shy. I'm really shy for real.
You don't feel like you side off.
I really gotta be like used to.
That's why I got, like, when I go to Walmart, I gotta be on the phone.
I be trying to figure out. I be picking up stuff that I don't need. So
Well, I'm sorry, like I'm on the phone sometimes, and I don't be on the phone to talk to me.
No, I can actually be on the phone with somebody when I go. But like, it ain't work. I don't sit down like that.
and I walk back. Talking. And I don't want nobody talking to me. If somebody talking to me, they're gonna reach out and
We don't judge, we just need some help, but we don't judge you.
I do need help.
Y'all probably gotta find, y'all might, I mean, some people feel comfortable with a man, talk to a man, some people like, just come talk to him. You gotta find like, who you
I had a
think you
mentor, but she ain't mentoring no more. Like she doing what a mentor supposed to do. I need to find
was it through like a program or something?
yeah, basically.
Well, maybe they got another one you could talk to.
No, I'm saying like the mentor ain't mentoring no more. She ain't doing what a mentor needs to do. Somebody she ain't doing what a mentor needs to do. That's why I'm calling no more. Cause like who I needed help like with college education and thinking about what I want to do. But I know what I want to do. Like I needed somebody opinion. She ain't nowhere to be found. You supposed to be mentoring. And then my other counselor, I tried to get in touch with her, but she ain't supposed to be making But I know what I'm gonna do now, so
Well, yeah, I could say you told me exactly what you gonna do.
yeah, I'm a double major. Because at first I feel like double major was a good idea. Then I had seen on Google, they were like, it's really no point.
Y'all
A lot. I like Aaron Rodgers. They were like, it was no point in having 2 bachelor's degrees for 2 majors. They said something like this.
So what you really want to do? I know you said culinary arts and
In cosmetology.
yeah.
Yeah, I want to do that.
So you want to do both of them? So how you want to do that?
I want to figure it out.
I'm gonna push.
It's like I might have
You
one
said do
major.
something you don't want to be a cat of these forever,
I
right?
don't.
I'm gonna retire.
Oh.
Or I might just do them both at the same time. I mean, I can manage my time like this.
But the thing is, both of them is like culinary arts having our time, like cooking and having our time, cutting and stuff, and then cosmetology that's our time. I mean, you could do both of them.
It's like I have big certain days. I do.
You might like if you got your own shop, you might just do it on these days, and then do your cooking on the other days.
I don't know right now. All I know I want to do is I want to do a major. And I want to do both.
So how's long gonna take you to do both of them at once?
I think like 3 years. Because a community college is 2 years long. But I think I'm gonna have to go an extra year.
I'm not trying.
I don't know. I'm doing dual enrollment this year, so.
A lot of my seniors, they did that this year. So I got some of them that don't take English. They're not taking English.
Here.
So they took it during the summer, I think.
I'm being kind of free. I'm 10.
What you trying to do? Alright, let's focus. Alright. Let's focus. Team.
Like, hey, I don't want to hear all this.
Alright, behavioral health is less important than physical health. Is that true or false?
Other systems.
Alright, so healthcare industry includes many other delivery systems. So you have emergency care services, provide immediate aid for the sick or injured, so that's like emergency rooms. Acute care facilities, they treat patients with sudden illnesses, trauma, injuries, post-surgery recovery issues. A stay in an acute care facility is typically very short, with patients soon being released to go home or to another type of healthcare facility. So acute care can be a hospital, but it just depends on what your diagnosis is, if you're gonna be there for a long time or if it's gonna be short. Ambulatory outpatient care centers provide a broad range of services, many of which are also available at a hospital. These services include diagnosis, treatment, consultation, and intervention. The biggest difference between hospitals that are inpatient and ambulatory care centers with outpatient are the length of stay and the general health of the patient. Cause like sometimes you can go to like a urgent care and get treatment if it's not anything that's like life threatening, or sometimes you might try to go to a urgent care and they might transfer you to a hospital if it's something they can't do. Ambulatory care centers serve patients with procedures that require a stay of less than 24 hours and patients that are generally healthy. Dental clinics are similar to dental offices, provide dental procedures and treatments. However, dental clinics often offer services at low or no cost. Clinics can be found inside or connected to other healthcare facilities, schools, or government offices. Hospice, they provide palliative care and counsel for terminally ill patients. So hospice is like when you like end of care and they're making them comfortable. You can do hospice at home, or you can do hospice people like actual hospice like house or something like that center. You have laboratories, they do tests to help diagnose illness and disease like blood work and other kind of tests. Healthcare agencies offer patients treatment and therapy at home. The healthcare industry is growing rapidly. There are endless opportunities for careers, advancement, and personal growth.
Specialty medical and dental services.
Alright, so in addition to general medical and dental services, there are many specialty services. So you got cosmetic surgery, that's plastic surgery, that's a wide range of services, procedures and surgery intended to improve the patient's appearance. Pulmonology, that has to deal with the lungs. So pulmonologists are specialists that treat patients experiencing any kind of respiratory related issues, from asthma to tuberculosis. Huh? Pulmonology? No, that's the actual doctor, but we work closely with the doctors. Yeah. So like if you go to like a lung doctor, that's what they're called, a pulmonologist. Chiropractic, that's non-invasive therapy involving the treatment, usually called adjustment of a patient's spine and joints in relation to the nervous system. Orthodontics, some of y'all might have braces. It's a dental specialty involving the correction and prevention of irregularities of the teeth and jaws. Surgical specialties for different body systems, age groups, and specific conditions. Examples are neurological, ophthalmic, and pediatric surgery. What? Y'all so loud. Then y'all got palliative care. Palliative care provides care for people with life-limiting illnesses. It might include collaboration with the patient's other medical providers, emotional, spiritual, and social support, and advanced care planning. The goal of palliative care is to provide or improve quality of life for patients and their family members and minimize symptoms and stress related to the illness. Palliative care should not be confused with hospice care, which is palliative, quality of life care for patients at the end of life stage. Alright, which type of healthcare service provides palliative care and counseling for terminally ill patients?
Hospice.
Yes. Hospice.
Hospice.
What type of healthcare service treats patients with sudden illness, trauma, injuries, and post-surgery?
FaceTime me with this in the shower.
You got it.
Your baby do.
Yep.
Come on.
Acute care facilities.
I was just gonna say.
So that's like a hospital. Sudden illness, trauma, injuries, post-surgery. Which specialty medical or dental service involves the prevention and correction of jaw and teeth positions? Orthodontics. Chiropractic treatments for the spine and joints in relation to the nervous system are often called adjustments. So when you go to a chiropractor, they can adjust you.
Lesson summary. In this lesson, what you'll learn.
Alright, so we're gonna look at government and nonprofit. So we're gonna identify the roles of government and nonprofit agencies, recognize specific examples of government and nonprofit agencies.
Government.
Alright, so the government has created many healthcare facilities. The U.S. has several government hospitals and medical offices. These facilities are supported by taxes. The facilities exist at several levels. You have international, national, state, and local.
World Health Organization.
Alright, so WHO, or the World Health Organization, is an international agency sponsored by the United Nations. It has 192 member states from around the globe. The organization's goal is that all people should attain the highest possible level of health. This includes physical, mental, and social well-being. Each year, the WHO investigates serious health problems and pushes information on worldwide diseases.
U.S. Department.
Alright, so the U.S. Department of Health and Human Services is a national health agency. Its goal is to protect the health of American citizens and to provide essential human services, especially for those who cannot help themselves. The HHS has several divisions to help meet the many demands of the agency's goals. Then you have the United States Public Health Service. It oversees the divisions of the HHS that cover public health. Here are some of the agencies that fall under the USPHS division of the HHS. So you have the National Institute of Health, you have the Centers for Disease Control and Prevention, you have the FDA, Food and Drug Administration, and then you have the Agency for Healthcare Policy and Research. Many smaller agencies at state, country, and local levels follow Department of Health and Human Services guidelines to provide health services for their communities. What is the goal of the WHO?
All of them.
So,
The second one.
Middle one? This one?
The second one.
Right, that all people obtain the highest level of health. Alright, what is the goal of the HHS?
All of them.
You sure?
It just sound like the right answer. It just seemed like the right answer. Take it.
Alright, so to protect the health of American citizens, to provide essential human services, to provide services to those who cannot help themselves.
OSHA.
OSHA, Occupational Safety and Health Administration. That's a government agency that enforces safety standards in the workplace to protect employees from injury and illness. It's also responsible for creating safety standards that apply specifically to healthcare facilities. So that's who makes all the standards about what you're supposed to do, PPE, all those things.
VA,
The U.S. Department of Veteran Affairs is a federal agency that provides healthcare services to military veterans at VA medical centers and outpatient clinics. The VA also provides veterans with many benefits outside healthcare, including disability, compensation, vocational rehab, education assistance, home loans, life insurance. Eligible veterans and family members receive burial and memorial benefits at national cemeteries. So if you have somebody that has been in the armed forces, then they get these benefits because they're a veteran.
Man, that grade is so far out.
Yeah.
We
Like
went
my-
to the one in Georgia, I think.
Fort Benning, like
Yeah.
down there. Yeah. So you get these different types of benefits. Y'all have a VA hospital here. It's one in Tuskegee.
This one up here, right? I
She
think.
just said it.
That's the one, yeah. And then my husband was telling me there's one on Chantilly or something over there. He works at a VA. Well, it's called QTC, but they deal with veterans also. Oh, good. All right.
Did they mean I quit
Today y'all what?
means I quit
Which government agency enforces safety standards?
VA.
Which services does the VA provide to eligible veterans?
That second with disability compensation, home loans, life insurance, vocational.
I think
All of the
it's
above.
All of the above.
It's all of the above.
It's all. They do all this.
I quit.
nonprofit agency,
I want you to help out my child. It wasn't moved.
All right, nonprofit agencies also play a major role in the healthcare industry. They are supported by donations, membership fees, fundraisers, government grants. Nonprofit agencies often focus on a certain disease or group of diseases. So you have American Cancer Society, that is dealing with cancer, people that have cancer. You have the AHA, that's American Heart Association. This is where, when we do CPR, this is the company that'll give you all y'all's card, American Heart Association.
Ooh, they better not pay with mine.
Ooh, you better pass the test.
I just want to see one of them things real quick.
No.
She just let you out.
I can see one of them.
No.
I just want to walk over there and see that.
No.
They help people for babies.
Huh?
I was talking about marching down.
Oh, Red Cross, they also, they do the blood drives. We usually do a blood drive here. I haven't scheduled one this year yet. But,
Won't get no, hey, won't get no blood over here.
March of Dimes, it helps to fight to prevent premature births through research, advocacy, education, and newborn intensive care.
I gotta march down here.
But one thing about Jackson Hospital,
They really should die.
they'll let your baby die.
Why do everybody keep saying that?
They let my cousin
Somebody
baby
else
die.
said that. Well, they just said you died, Jackson. What am I saying?
She had something, and the doctor just kept on sending her home every time she kept on coming up there.
So just the baby died? She didn't die, did she?
She had a stillborn. Both of my cousins, both of them did. Actually, her and her sister.
Really?
Maybe something just right.
Ooh. Alright.
Take the best down.
Teachers, please excuse this interruption.
That sounds so
Teachers, there was some information put in all teacher mailboxes on yesterday, that should be passed out to your first period students. This is information that students will take home to their parents so that they can access, their grades. This is almost like the parent portal from iNow. We need for you to pass that information out today, so teachers, if you are able to come down to get the information out of your box, you can do so immediately, so you can pass it out this morning. If you are not able to leave, please send the student down with a pink pass, and Mrs. Bigman will be standing at the door to send it up to your classroom. Thank you.
All right, one role of a nonprofit agency is to promote public awareness of a disease.
true.
The FDA is an example of a nonprofit agency.
Wow.
Alright. We got government agencies, we got nonprofit.
Food and Drug Administration. With FDA and government.
Okay.
ACS nonprofit.
American Red Cross, nonprofit.
Why can't Mr.
Because I'm trying to focus. Leave me alone. American Heart Association. That's not
Huh?
perfect. American Heart Association. Where's you trying to have a race
And the rest of
for?
them is government.
God damn. What? I'm sorry. He out here trying to have a race. Like, dang, calm down. We know you be paying
You
attention.
the other. Oh, I thought that's
I'm
what I
talking about him, baby. I'm trying to get an answer out. He up here trying to talk our face.
All right, we got two more.
Close your mouth, bro. Let's go put that man back. Put that man back.
We got the last two. What is it?
World Health Organization. Go under government. International institutional health. I don't know. Government.
All right.
Lesson summary. In this lesson, what you'll learn after you
All right, this is the last section. All right, we're going to describe organizational structure and healthcare. We're going to explain why the line of authority is important to healthcare facilities and define interdependence. What?
organization
Y'all gonna come in here, y'all gonna have a seating chart, everybody gonna be spread out. All this talking extra.
Because they take your kindness for you. You know, like.
How about this? Everybody just be quiet, pay attention, because you have a quiz after this.
When you was gonna say something about that?
I'm just teaching. If you get it, you don't. We're gonna see on the quiz. We'll see what the grade is.
I don't know quiz of the day. We can get ready to go.
Can I see, do you have like papers or like which I can go over?
All these are all Google Classroom. I record the lesson.
Blue Classroom, you only got something like a YouTube thing that's like some last and then when you come out.
No, I haven't put everything on Schoology yet.
I think you know my phone.
Yeah, I put some recordings on Schoology. Alright, every healthcare facility must have an organizational structure. An organizational structure helps a facility to run smoothly by outlining the responsibilities of the employees. The structure may be complex or simple and will vary depending on the facility. This organizational chart shows 4 divisions within a healthcare facility. You have informational, support, diagnostic, and therapeutic. Each division is broken down into several key functions. All right, why is organizational structure important?
The second one.
I got all the above, and then I got all of them.
line of authority.
All right, so a line of authority must be decided for every department within a healthcare facility. The line of authority determines a worker's position in a facility's organizational structure. The line of authority also establishes level of supervision. Healthcare workers must report any questions or problems to their immediate supervisor. If the immediate supervisor is unavailable, the problem should be resolved with the next level of supervision. This organizational chart shows the line of authority for a typical nursing department in a hospital. For example, registered nurses report issues to the head nurse. However, medical assistants should report to a licensed practical nurse. So you have your nursing department, the director is at the top, and then everything falls under it. So at the bottom, you have your medical assistants, your PCTs, your unit clerks, and your volunteers. They report to the LPN, who reports to the registered nurse, who reports to the head nurse. So that's how this line of authority goes. All right, healthcare workers should report to the highest level of authority when they have a problem. Y'all got 50-50.
True. Not no old.
Come on, bro.
You just report to the person that's directly over you. You don't have to go to the highest level.
Oh.
That's on the first.
All right, what is one purpose of a line of authority?
I want to go with the old
Medical office structure.
All right, so the organizational structure and line of authority at a community medical office are likely to be very different from those at a large medical facility. The doctor is a primary supervisor at a medical office. However, most medical offices employ an office manager to help oversee the daily functions. This organizational chart shows the structure and the line of authority at a medical office. If a medical assistant has a problem, the issue should be resolved with the supervising registered nurse. However, if the registered nurse is not available, the problem may be discussed with the office manager. So same thing here. In a medical office, the doctor is the head, and the office manager falls under them. So the office manager is in charge of the business office, housekeeping, nursing, and lab. And then business office, you have clerical, billing, and insurance. Under nursing, you have the RNs, the LPNs, and the MAs. And then laboratories come by itself. So if the medical assistants have a problem, they report to the LPN. LPN has a problem, they report to the registered nurse. And then if the registered nurse has a problem, office manager. But if somebody is out, then you'll go to the next person up. The structure of a medical office is very similar to the structure of a large medical facility.
Students, please excuse the interruption. Only the students' names that I call. Please report to the media center. Victoria Giles Tucker, Berkea, Kimberly, LeBrian Kathy, Shania Shine, Kimberly Youngblood, Jalen Johnson, Bobby Henderson, Brianna Jones, Dejan Gibby, Dalen Perryman, Jada Allen, Michaela Clark, Ayana Felter,
MJ
Corinne
Jones.
Fernandez,
Wait.
Faith Thornton, Jayla Washington, and Trinity C. Please allow those students only to report to the library. Thank you.
All right, well, who is a primary supervisor of a medical facility? All right, so according to this chart, who should the volunteer workers report to? So if you got volunteers, who should they report to? LPN. Right, so you got the volunteers down here, they'll report here. According to this chart, who should licensed practical nurses report to? Registered nurses, right.
Respecting the chain of command.
Alright, so the line of authority not only establishes organizational structure, it also dictates the chain of command. In return, following the chain of command reinforces the organizational structure. So you have strength, that's reporting to the proper person, strengthens the structure. If you go around who you're supposed to report to, that weakens their authority, which weakens the whole structure. Efficiency, respecting the chain of command also promotes efficiency. An immediate supervisor is typically the best person to handle an issue at that level. If the issue involves other supervisors or input from higher level roles, the supervisor can consult them. Then you have focus. When the chain of command is not followed, it can leave employees feeling uncertain as though the ship has no captain. An uncertain environment can negatively affect productivity.
When to escalate.
Alright, so when you should escalate problems, respecting the chain of command can make it easier to understand when to escalate issues and to whom. Each healthcare system or facility should have a process in place that helps healthcare workers determine when to apply problem-solving skills independently and when to escalate the issue to someone above them in accordance with the chain of command. Effective healthcare teams observe the facility's problem-solving and escalation practices to efficiently and effectively resolve patient and staff issues. Alright, respect the chain of command and reinforces what?
Organizational structure.
Organizational structure.
Why he ain't got none of this?
When you blank a problem, it usually involves reporting it to the next person in the chain of command. Escalate.
Reporting issues.
Alright, so when you're reporting an issue to a supervisor or the next person in the chain, it's important to follow the process outlined by your healthcare facility. So each facility is going to be different of how you report things. Along with your facility-specific processes, other important factors need to be considered. Follow your facility's process. research the existing process, develop a thoughtful plan, explain your concern to your supervisor, and share your idea for resolving it, and then be tactful and confident.
Interdependence.
Every healthcare worker is part of the healthcare team. All members of the team are dependent on each other. This is commonly referred to as interdependence. If one worker does not fulfill the required duties, the entire team is negatively affected. And when the team is not functioning properly, patients do not receive the quality care they deserve. Imagine what might happen if the secretary at a medical office stopped answering the telephone. Patients will not be able to make appointments, and the team would be unable to perform its duties. Or imagine what could happen if the housekeeping department stopped cleaning. Many patients will feel uncomfortable receiving treatment in a dirty facility. In addition, patients and healthcare workers could be at risk of getting infections. What is the connection among all levels of healthcare workers called? Interdependence. Which of the following should you do on reporting an issue? So you want to follow your facility's guidelines for reporting issues.
Lesson summary. In this lesson,
Wait a moment.
I thought it was like one by one.
You go too far.
I press that green check, please. Right there.
She's trying to move her face in the middle of the screen. We see you.